Hi everyone, it's Sue here, and I am so excited to be starting this course with you, Nursing 3403 High Acuity Nursing. And this really is my passion. I have to say, I teach lots of things and I love lots of things. I love almost everything in nursing, but what I love most of all is high acuity nursing. And I sure hope you will love it too and enjoy the course as we work our way through all of the weeks. So let's just spend a couple minutes here talking about what it's going to look like week by week and the assessments, all things like that. Course textbook. I know I've already heard from a couple of you, sorry to be late with providing you with this information. We're going to use a really classic critical care nursing textbook. It's written by Soul, Klein, and Mosley, or they're the editors. The 8th edition is the most current, and you'll see the picture I have here for you is the 7th edition. 7th edition is fine, 6th edition is fine. I'm not picky at all because you're going to get the foundational concepts. There's nothing so specific that would make any difference. So get what edition is most available to you. You can get it as an electronic book, or you could get that as a paperback or hardcover book, and you can get that online through a variety of sources, right? So look at Amazon, look at wherever you want to buy a book, or from the publisher if you want to get the electronic copy. In addition to the textbook, there's a variety of weekly readings. Some I'll have posted. So in the course Canvas shell, I'll have a posted resources within the week that we're working through. There'll be video lectures. So like I'm doing this, a Zoom over the PowerPoint. I'll probably have many of those, several of those per week. Hopefully they're exciting and short tidbits or short learning episodes as opposed to something really long. And heaven forbid that anything be boring. Also, you'll see some instructional videos or YouTube videos. If something has already been done and done really well, I'm not going to try to make something that may not be as well done as what we can already find out there. So I'm going to try to point you to the very best resources that we have. And there's also just an EKG or ECG interpretation workbook that Leslie Graham and I have created together, and that will be posted for you as we work through those different strips. And you'll find that as we move into the ECG interpretation modules. So let's talk about what we're actually going to focus on in the course. And that requires that we sort of take a quick peek at the week by week. And what I'm going to do is actually minimize this and bring up a document. You'll have this Word document loaded into the same module that has the course syllabus and any rubrics, things like that. And this course at a glance I find really helpful because week by week you can just see the highlights of what are the readings, what's due, what are the expectations as I move my way through. So let's take a moment and look at what we're going to do. So week 1, this is part of it. Welcome and overview of the course. I'll talk a little bit in another recording about the course philosophy and the difference between memorizing and understanding materials and how we want to work our way through that. And that really influences how you'll be writing tests or other things. We'll talk a little bit about what exactly is high acuity nursing, what makes a good high acuity environment, and what makes a good high acuity nurse. I want to talk about something called thinking biases, and I hope you find this interesting. It's really important because they're going to get us. If we don't pay attention to our thinking, it's so easy to fall into these biases, and they can lead to really dramatically poor outcomes for patients if we're not careful. And then, oh my gosh, we're going to get started right away. So that's all the sort of theoretical, philosophical, big orientation, and boom, we're getting started right away. So you think you know vital signs. Well, we all know the basics and taking vital signs and then some basic patterns. We're really going to take a little bit of a deeper dive. I hope you will find it helpful. Probably lots of you know this already, and it's just going to be a review. But for some of you, I hope it's all new. What we're going to look at is that basic interpretation of vital signs elevated to a level where we're always saying, what is the compensatory mechanism here? Is there a compensatory mechanism that that should be in place that I'm not seeing? What kind of factors could either be causing this or could be preventing what I would expect to see? And that causes you to look for greater information, look at the patient in more detail, really you become a detective using these vital signs. And I just have to say, often we don't place enough gravity on vital signs because we forget that it's not about acquisition of vital signs, although always pristine acquisition. It's about that interpretation, and how does that interpretation lead us to where we need to go. So I hope you will find all of that in week 1 helpful. And then if you move along, you'll see that the clinical focus, sometimes there's skill-based things there to just remind you. This is a reminder about vital signs. Nobody needs it, but in case you want to just look up, oh yeah, what's the perfect technique? There you go. There's a nice link. In terms of readings, you've got chapter 1 from your course textbook, the SOUL textbook. I will post an article called Something Isn't Right. And that is really talking about patient deterioration and being aware of early signs as opposed to late signs. And you're going to hear me say this probably every week in the course. If you're waiting for somebody's blood pressure to drop to call it shock, then you can't be a high acuity nurse. You might as well just stay home. That's a late sign. And we always need to be looking for early changes in patient condition that will help us to be, again, that detective, that investigator that looks further and deeper and tries to understand what's going on in a situation, so that not only can we move to a rescue when we talk about that rescuing patients, but that we can actually move to escalating, which means that we are preventing something serious from happening. And so that's you'll see those readings, and there'll be, again, the online lectures and videos that I'll point you to. Each week you'll find those. Each week we'll have a separate module that has all of the resources for that week. In week 1, in terms of like postings or engagement, you're going to do a scavenger hunt. And again, it's up to you whether you do it or not, but it's worth 3%. So do it completely and perfectly with no gaps. You get 3 marks. Isn't that amazing? Don't do it, you get 0 marks. And then there's like a little bit of a 1 or 2 for partially doing it and other things. So there'll be a scavenger hunt posted. It is due by the end of the day on January 17th. And the due dates are really firm in this course, only because there has to be some way to level things. And so all of the engagement activities, whether it's a simulation or some other activity like a scavenger hunt, and later on you'll do a learning module, for sure you can be successful in the course without them, but each one of them is a great opportunity to cement your learning and also to really improve your grade in a very dramatic way, because in total they're worth 15% of your grade. So that's week 1. I won't go into as much detail with the other weeks, but we'll give you a sense. Week 2, we're going to jump into fluid and electrolytes. I know everyone has taken fluid and electrolytes in patho, right? But what we're going to really pull together is some basic understanding. I like to take it right down to the ground. And so you'll see some YouTube videos, and I'll keep adding to the your module folders. If there's a resource I want you to review, it's there. Think of this course as a glance as a living document that as the weeks go by, I may add additional readings or more likely resources. But the goal is not to overwhelm you or overload you. It's always to simplify. So when we talk about fluid and electrolytes, my goal in terms of fluid is to say what's a hydrating fluid, what's a maintenance fluid, and where are we managing patients in terms of the volume of fluid we would expect to administer. I may not be the person writing that order, but every time I see an IV order, I need to determine if that's appropriate. And how do I make that determination? So I don't want it to be just abstract and theoretical, although we'll begin there. I want it to just come down to the nitty gritty. So I hope you will find that interesting, because what I would say is a good handle on fluid and electrolytes is so important to providing really good care, so that you can look at something immediately in a situation, say, I need to check that patient's sodium. The symptoms that I'm seeing are potentially related to an alteration in their serum sodium level. Or when I'm looking at a patient's condition and I'm looking at the IV solution that's hanging, is it appropriate, and how can I make that determination? Okay, that's week 2. Week 3 is an interesting week because we're going to begin looking at hemodynamic monitoring. And so that'll be, I hope, a lot of fun for you, because we're just going to provide you with some opportunity. Unfortunately, we're not in a lab and we're not going to be able to do hands-on, but we'll do some videos, some that we'll do ourselves, some that we'll point you to that have already been done. around some skills that you may not yet have had an opportunity to do, but to give you an overview of the basics of them. So for example, giving medications IV push, although you won't do that until you're an RN, and typically until you're an RN and then certified in your workplace. Still knowing the procedure for something like that is really important. And it would be better, we believe, to learn it here than to wait and just learn it in your workplace. So the theory of that and to be able to demonstrate that. We're going to talk a lot about titration. So how do we titrate infusions? And that's where we really talk about some medications that are complex. And we're also going to do some medication calculations that will help you understanding that whole process of titration. We'll talk a little bit about non-invasive monitoring. And that's where we bring in things like JVD assessment. We're going to talk about arterial lines, how exciting. And, this is not going to be overwhelming. If it sounds like it's a lot of stuff, I'd say hang in, don't worry about it. If it sounds like it's too easy, I'd say hang in, it's going to be great. Central venous pressure monitoring and looking at central lines and PICC lines. All right. And so then we begin that process. There's 2 times in the course where we look at ABGs. The first is in this hemodynamic monitoring week. And then when we get to acute respiratory complications, we'll look at those again. So we'll talk about those. And then by week 4, it's our first of our pulling it together weeks. And in week 4, we pull it together by understanding shock, because shock is a fundamental complication associated with a lack of oxygen at the cellular level. Don't worry, I'm going to bring it all to you in week 4. It's important because the type of shock really has implications for the type of treatment. So all shock is not the same at all. And so we're bringing together vital signs, fluid and electrolytes, hemodynamic monitoring, all to bear within the context of shock. And I hope you find it so great. And you're going to do your first simulation. So in your simulation, you're going to work with your small group. All of you will find that you're assigned to small groups. The groups typically have about 6 students. And within a small group forum, you're going to be able to complete what's called an asynchronous debrief, and that'll be related to the simulation. If you can hang on to any questions or thoughts you may have for a second, because I have a slide that we'll talk a little bit more about simulations. So again, that's worth 3%. The due date is firm, end of day, February 7th. Then we have our first midterm test. It's open for 12 hours, 11 a.m. to 11 p.m. on February 12th. It won't take 2 hours. It should take 2.5. It won't take 12 hours. It should take about 2.5 hours. But it's open that period of time so that you can complete it within that time frame. If you have a problem with that time, I know some of you are working and other things are going on, please just contact me and we'll work it out. We have a break that follows and then back at it. The next 4 modules are all, let my heart stop pitter-pattering, ECG interpretation. Oh my gosh, the beauty of watching a beautiful heart rhythm and understanding how that serves the body and how it functions well, or where there's alterations in function that we can hopefully support the person. So we'll move from basics of what ECG monitoring tells us about, how that whole thing works, the electrophysiology, mechanical movement, things like that. Then we're going to actually get into those rhythms. Oh my gosh, I can hardly wait. I wish we could do it right now. Week 3, we're going to carry on with that. And we're going to, by the 4th week of this second grouping, so week 9 of the course, oh my gosh, number 2 of pulling it together. And that is going to be that ECG interpretation within the context of a nursing situation. So it's not just looking at a strip and making a diagnosis on paper or an interpretation on paper. It's actually bringing that in and how then do we intervene within that context. And that will be our second opportunity to work as small groups in a simulation. And that, again, worth just 3% and handed in March 21st. Week 10, you're going to have the second midterm, and that is open again, 12 hours. It should take about 2.5 hours. And you can write it within any time period. I'll talk more about that. And then we're moving into the last 2 weeks of the course. In week 11, we'll talk about high acuity respiratory care. And that's where we're going to talk a lot about the kind of ways we can support people through acute respiratory distress, including the use of things like CPAP or BiPAP, Optiflow, which is a really important game changer in oxygen administration. Positioning, I'm sure a lot of you have seen talk of proning, where patients are placed prone for 23 out of 24 hours a day in the midst of COVID, things like that. So we'll talk a lot about that. I have a real thing about this idea of how do you assess work of breathing. As a respiratory therapist, work of breathing is a chemical term, and it really refers to a lot of different things, and it's a chemical calculation. For nursing, work of breathing really relates to how much effort and energy a person is taking to continue to maintain whatever oxygen saturation they have. And so it's such an important indicator. It's not just looking, it's looking at the patient with important indicators as well as what readings you have. So we'll talk about that. That week, you have an opportunity to complete a mechanical ventilation module online. You get a little certificate after completing that, and you'll get 3% just for proof of that. And then finally, week 12, break my heart, the course will end. We will be talking about breaking bad news. It's so much a part of what we do in nursing, not that we make a diagnosis or communicate a diagnosis, but we definitely are part of that whole communication. And we'll also have our opportunity for our third and final pulling it all together, our synthesis, and that will be an ACLS overview. So we're going to talk about the ACLS algorithms, which is really takes it to a higher level. I know all of you do your BCLS certification, but takes it to a higher level for you in understanding what kinds of interventions might you be involved in when a patient is having a cardiac arrest or having demonstrating a rhythm that would be needs acute intervention. So I hope you'll find that exciting. Again, you'll be doing that within your small groups. The final exam is going to be in the exam period. And that's it for the course at a glance. So let's get back to everything else. So the evaluation mechanisms, and you've heard me talk a little bit about it. So midterm test one, I told you when it is. I say on this slide 2 hours. I usually give you all a leeway of about half an hour. It's fine. I think it could be completed by calculations. It should be completed in 2. I always give a little bit of room here because of the way we write the test in this course, and I'll talk a bit about that. Midterm test 2, same thing, final exam, date to be determined, and they'll let us know that. For all of the tests, they are open book. You can write them using any resource that you want. So you could look something up on the internet. You can make notes ahead of time. You can use your PowerPoint slides. You can have your textbook and all that. What you cannot do, and I'm going to ask you to sign a document about this, is you cannot consult each other. So it's not just the whole class writing it together or people sitting together doing it. It is actually a test. But what I believe in this course is that nurses in 2021 need to know how to use resources, not just memorize everything and hold it in their heads. So it's totally fine. The questions should be written in a way that you can't just find a simple answer, but you need to make sense of them. And there's enough of a time constraint that if you spend all your time trying to look something up, you're going to lose enough time that you won't be able to get to the end of the test. So they will be, in that sense, an open book test and you can use any resource you want. What you cannot do is communicate with any other person. Okay, and I'll talk more about that in the course. And also those engagements I talked about, week 1, the scavenger hunt, and that just really is a scavenger hunt in the course. How do you find your small group? Did you say hello to your group? What are the dates? All the things that are going to help you to feel familiar with what's happening in the course. We're going to have 3 simulations. Those are in week 4, week 9, and week 12. And then in week 11, you get to do the mechanical ventilation online module. And I'm so sorry, I've got a little bit of a typo here. It says 2% for those simulations, but they are worth 3%. You'll see that in week 2, I also asked you just to make a brief post in your small group and in a large group discussion board. The only reason I'm doing that is to make sure, and that's just pass fail, which means just do it. You just have to say hi everybody, or answer a question that I've posed there, to make sure that everybody knows how to find their groups and how to find those discussion boards. Okay, so let's talk about the simulations. By now, all of you have done simulations in a variety of ways. And there's a variety of components, and they're all essential in order to complete the simulation. You need to do a self pre-assessment. And what you need, it's just a very simple document that asks you to consider what would be, competent, marginally competent. You don't feel competent in a variety of objectives related to the simulation. You just complete that. You might write a sentence or 2 for each of those objectives, describing where you see you might have a gap or how you see you might have a strength. And then you're going to upload that to Dropbox, to the Dropbox for that simulation pre-assessment before you complete the sim. the prep materials will be provided for every sim, and sometimes it's just the course readings for that week. Sometimes it might be something additional that's specific to the simulation, but it will be listed. You'll have a recorded pre-brief, and that may just be like 5 or 10 minutes talking about what the simulation involves, what the focus is, what would be relevant, things like that. You go through the simulation experience, and in the simulation experience, you're going to click on a link. It's going to take you to a simulation. There's a variety of different ways that you can go through a simulation. Some are like a game. Some are a stop-start where they ask you a question. You get some information. You decide what is the next step, things like that. And it's just 3 simulations we'll be choosing. They're critical care simulations developed by CanSim or Health Canada. And they will be, I hope you'll find them really valuable simulations. And then you're going to do what we call that small group asynchronous debrief. So all of you will be placed in a group. That's about 6 students in a group. And there will be a list of questions. The questions are all the same for all the groups that follow the simulation. Once you've completed the simulation, there'll be a list of questions that require you to think about the simulation and to take that learning further. And all of you individually within your small groups of 6 are required to answer those questions, submit those answers, and then respond or engage with each other in that small group form. And then finally, you will do a post-assessment following all of these activities where you just again, look at those criteria. And after you've completed the simulation, you're gonna consider the same criteria as you did when you prior to the simulation, and you're still gonna ask yourself those questions. How competent or not competent do I feel across these variety of objectives? Just to make a point here, sometimes it feels overwhelming the first time you hear a lot of stuff. I hope this doesn't feel overwhelming, but if it does, rest assured that week by week, I'm going to be just pointing the focus to where we're going next. And when we get to the week where we're going to do the simulation, I'm going to be very clear in making sure everybody understands what the focus is and what the expectation is. So hang in there with me. Tests, I told you, they can be written independently. They must be written independently, but using any resources you want. And the kinds of questions you're going to see: multiple choice, ranking priority of interventions, choosing all that apply, short answer questions, and ECG interpretations, or lead 2 interpretation typically. Most important, what I would say from me to you is stay in touch. Write me a message on Canvas anytime, and that should go to my email. Ask questions all the time. Great questions come up. And if you've got a question, probably lots of other people have a question. Sometimes you've got a question that nobody has, and it actually brings all of us to a greater point of dialogue or thinking. So really, please ask any questions, and we'll try to keep a dialogue going through the discussion boards. Explore both independently and together. So this course really asks that you have an open mind around thinking and learning. That acquisition of knowledge isn't just for yourself, and it's not just so that you become better and smarter and a better nurse. It's for all of us. So working together is great, except of course on the test. Learning from each other, engaging well with each other through that simulation discussion, things like that. I hope you enjoy the course. Boy, I hope you enjoy the course. Is it a hard course? Yep. Every course I teach is probably a hard course. This is a hard course, but I hope you love it. The whole point of teaching this course is to have you say to yourself, I've got it, right? I can do this. And I know all of you can do this. This is the future for many nurses who are graduating now and moving out into practice. So many of you will see the patients who require higher acuity nursing, regardless of where you're practicing. If you're practicing in a long-term care facility, if you're practicing on a rehab floor, if you're practicing on a medical or surgical floor, if you're practicing in a setting where you expect it, like the emergency department or the ICU or the PACU. So I hope there's great opportunity to really feel that this is exciting for you and you're really growing and challenging yourself. And I hope that you are fearless learners. When we talk in the short discussion about what I think, how I would define a high acuity nurse, I would say a high acuity nurse is fearless. It doesn't mean that you don't recognize the challenges and you don't feel sometimes overwhelmed. You just keep walking through it. You just keep going. And I know all of you have that. Look where you're at right now in your lives. Look what you've done so far and where you're going to go. So today, I hope, is the beginning of that journey for 12 weeks. I really am looking forward to it. I'm sorry that we won't be face-to-face because I just love that opportunity to be with you in the classroom. But I really hope we have lots of opportunity online to get to know each other and to really feel what it's like to be in a community of learning. Thanks so much, and I look forward to working with you this winter.